Okay, let's try this again. So your patient has had a primary line going, and the doctor says that we can discontinue the primary fluid and just leave them with this intermittent device so they can get up and walk around and even get a shower. You can cover this area up while they shower. But we still want to keep this in place because you don't want to take out and start a new IV 2 or 3 times a day. So we've turned off our pump. I've clamped everything down with gloves on. I'm just going to unhook the primary line. From that, I would throw all of this away. I would count my I-No. And then I've got this left. So now the patient can get up and walk around. And per your agency protocol, this may need to be flushed twice a day. And you would just unhook it and you would flush it with saline and document, usually about 5 cc's of saline. Then whenever, say, your patient needs their dose of Rocephin at night, then you would hook them up to the pump with the Rocephin. And then once it finishes in 30 minutes, you would just take it off, flush it again, and then they won't be so tied down with this big pump. Because anymore, the patients are encouraged to be up and to be mobile because it keeps them more active. It cuts down on the risk of infection and developing a respiratory issue. So this is your intermittent device. Again, you'll hear old nurses call them HELP locks. They are documented as saline locks because that just means we're finishing them out with saline. But that's what's left on your patient. Again, this has to be changed every 72 hours. And a little word of advice of lesson learned the hard way. Let's say that this is due to be changed today. Before I just take this out, and it's working beautifully, it's not infected, it's not infiltrated, it is not got phlebitis or anything. Before I take it out, I'm going to be sure I can get a new one started. Because say they've got an antibiotic due now and I've taken this one out and I can't get a new one started. I could go ahead and use this one until I could get another one started. So don't jump the gun, be sure you can get something else started. See, we've had one here, so our next one would need to be up higher or in the opposite arm. Now, if I was going to do a medication through this, again, I would have to check it for placement. I just can't walk in and hook Rocephin up to it because I'm not sure if it's in place or not. So that's when you would get another one of your flushes. Your saline flushes may usually have about 5 ml of normal saline with my gloves on, and I would clean the hub. I really feel bad not doing this without my gloves on, but I don't have any right here, so overlook me. But anytime you're doing with IVs, you need to have your gloves on. I'm going to clean my port. I'm going to take my saline and I'm going to connect it. I'm going to open. And then as I flush it with my saline, I'm going to watch to be sure that it's not puffing up. If I'm not sure, I can always pull back and see if a little blood comes back in the line. That's why I know I'm in there. And I'm going to flush it with my 5 mLs. Really slow. Because if it puffs up, you've bloated. So I'm going to flush it with my saline. I'm going to clamp it. I'm going to unscrew it. I'm going to clean it. I could hook my antibiotic up to it. Or even say if I was giving Lasix through it, if I was doing an IV push, if I was giving pain medication through it, I would give my medicine, I would clean it again, then I would have to flush it again with saline. Again, the SASH method, we use heparin to it, but we don't use heparin anymore on peripheral lines unless the doctor tells us to. Then you always clamp it back off. And that's how you use your intermittent device.